Today I'm going to discuss an extremely important topic which affects all our lives. And also I'm going to give you important signs that you can start watching from today so that you can keep your heart and all the blood vessels in your body healthy and prevent major problems. The arteries supplying the heart or the other organs of the body, they're extremely important because India is the #1 capital of diabetes, which leads to blockages in these arteries and which has multiple consequences like stroke, heart attacks, problems with the bowel, problems with the legs, even leading to amputations. Firstly, let's talk about how these arteries work. The arteries supplying the heart arise from the main artery, which is called the aorta, which supplies good blood to the entire body. So the arteries supplying the heart are called coronary arteries. They arise from the main aorta, which arises from the left ventricle, and this supplies pure blood to the entire body. The coronary arteries supply blood to the heart. Now, these coronary arteries are the life of the heart. If these arteries start getting blocked, then the functioning of the heart gets affected. Arteries are blood vessels in the body which supply blood and which carries nutrients to different organs of the body. These are important in the entire circulation. And if we know the arteries, we also need to know the veins. Veins are vessels which carry impure blood. That means after the organ has consumed the nutrients, it sends the blood back to the heart for purification. That is carried by the veins. Now, these arteries can get narrowed due to cholesterol deposition or can suddenly occlude due to a clot formation, which is called a thrombus. These can have disastrous consequences. Hence, we need to be aware of these arteries, what signs they produce, what problems they can create, and how do we prevent or treat them. This is a common question I'm faced with. At what age should I start worrying about these arteries getting blocked? So you need to have a risk assessment score. This is a score which is created by scientists in the world and which are used by doctors. So you need to know whether you are at low risk of developing this problem, intermediate risk of developing this problem, or high risk of developing this problem. These scores are based on multiple factors. I'm going to enumerate a few. Presence or absence of diabetes, presence or absence of having blood pressure, cholesterol, obesity, lack of physical exertion, addictions, family history of heart disease, to name a few. Once we have this assessment of an individual, we bracket them into low risk, intermediate, high risk. Once you fall into that intermediate or high risk group, then you are someone who should start as early as possible. So probably in your late 20s or even early 20s, you should start monitoring your sugars, your cholesterol, your blood pressure, and change your lifestyle to prevent the occurrence of this heart disease. Once you're in the low risk, we only recommend lifestyle changes, but we probably do not investigate them at such an early age. Treatment options vary for these problems. Once you detect that you have narrowings in your arteries, by whatever means we detect it, we need to offer solutions for that. Solutions are preventive versus therapeutic. Therapeutic means treatment. Preventive strategies include lifestyle changes, controlling your sugars, controlling your weight, controlling your blood pressure, and in addition, giving medications to lower the sugar levels, lower the blood pressure, lower your cholesterol levels, blood thinners if there is a need for that. These are mainly preventive strategies. Treatment strategies can vary depending on the organs that are involved. It varies from giving clot-busting drugs, blood thinners, implanting stents, and sometimes surgical option where you do a surgery to circumvent these blocks. By the way, if you're liking this video, don't forget to like and subscribe. Now let's get into the signs of narrowing of these blood vessels. The signs vary depending on the organ that is involved or the system that is involved. So let's start with the arteries supplying the brain or the neck arteries. If they develop narrowing, cholesterol deposition or clots, they can lead to minor stroke, wherein you might have a little facial asymmetry, or you might have tingling numbness of the fingers, or you might have mild paralysis of one limb. But if there is significant narrowing and a large clot burden, you might develop a major stroke wherein you may lose speech. You can also lose complete movement of one side of the body, which is called hemiparesis or paralysis. And sometimes it can also cause a bleeding in the brain, which can give rise to epileptic seizures, which is also called fits in common terms, or it's called epilepsy. Coming to the blood vessels supplying the heart, which constitutes major problem and major cause of death in the entire world and also in our country. So when these vessels get narrow, it starts with symptoms which are called as angina in medical terms, but in layman terms, it is chest pain or heaviness in the chest when you exert. So as you walk or you climb, you feel a clamping sensation in your chest as if there's some weight or a rubber band holding the chest and it's not releasing it. And this clamping feeling can go into your hand, can travel into your jaw, or can travel to the back of your body. And the moment you rest, these symptoms start subsiding. This is classical angina, which is experienced in patients who start developing narrowing. In some patients, you just get breathlessness. You may not get chest pain, especially in diabetics, where the nerves get damaged. You may not get chest pain, you may feel breathless, or you may just feel that you're generally unwell and you're losing strength, you can hardly walk. This can also mark narrowings of your blood vessels of your heart. And another thing to remember, that everybody does not get classical symptoms which I described. Some of them may complain that they have some woozy sensation just below the chest, which feels like gas or feels like a gastric disorder, and it feels better with burping. But this can still be a heart disease, so you need to understand that. Now, this is angina that we're talking about. But when the blood vessel gets completely cut off with a clot, then you get something called myocardial infarction or a heart attack. This is a life-threatening condition and has to be addressed immediately. There is no waiting in this condition. You cannot wait to see if it disappears. In this, you get the similar pain, but it is significantly higher in intensity. It can be excruciating. It can be associated with vomiting. You might sweat a lot, and this pain doesn't subside. It doesn't let you sit. It doesn't let you lie down. These are signs that you might develop a heart attack, and this is the time you immediately need to go to the hospital. There is no waiting to decide whether it's going to subside. Blood vessels supplying the abdomen or the bowel can also cause symptoms like pain in the abdomen, which many of times is ignored because people get pain due to gas, people get pain due to gallstone, due to ulcers. But if this pain is associated with pre-existing blocks in some other organs, like the heart or the brain, then you must think of something called bowel ischemia, where the blood supply to the bowel is getting cut off, is reduced. So once you get this, you need to see your doctor, who will decide whether you need further tests to look for these blocks, and treatment options can be offered. Another extremely important blood vessel is the descending aorta and the iliac arteries and the femoral arteries, which supply blood to the lower limbs. This is a major problem seen especially in smokers and diabetics. When these vessels start narrowing, they cause something called intermittent claudication. It is similar to angina, but this is angina of the legs. So when a person walks, he feels that the calf pains and the calf muscles get sore and stiff, and the moment he rests, the calf muscles settle down. The variant of this can be more severe, especially when there is clot formation, especially in diabetics. In these patients, you can start developing pre-gangrenous or gangrenous changes of your toes. When I mean pre-gangrenous or gangrene, it means your toe starts changing color. Normally, toes supposed to be pink or slightly whitish pink, but if they start becoming darker, or they become greenish, or they become black, that means the blood supply has been suddenly cut off to your toes. And if you do not consult your doctor quickly, you might end up losing the toe or sometimes even a foot. To summarize, arteries are important because they are the lifeline of a body. So if the arteries get occluded, and if you get a heart attack, or if you get problems with the kidney, or you get a stroke because of that, or your legs develop amputation, it significantly impacts your life and also your survival rate.